Hello, everybody. Welcome back to ChimpChat, where we are talking with business leaders and industry experts about their take on what they do for a living. We are joined today by Dr. Anjali Noble of the Noble Center for Health and Healing. Dr. Noble is a board-certified internal medicine physician and a specialist in functional medicine, where she helps individuals live healthier and be happier with a holistic range of modalities in addition to traditional Western techniques. Welcome to the show.
Hi, thanks for having me.
All right, so let's get right to the stuff that everybody wants to talk about, which is COVID-19 and coronavirus. What are you seeing in your practice, and what kind of advice are you giving to your patients with regard to coronavirus and COVID-19?
Well, there's been a lot of anxiety around it, and it's something that I've always done in my practice is to help people be healthier, prevent issues like this. So majority of my patients are on board with having good immune systems. They've been practicing this type of way of life. It's more of a way of life in functional medicine to be healthy and be your healthiest you. So when these things do arise, we don't get sick. And you're seeing that this is of most importance with COVID right now. It's the patients that have a good immune system, that are healthy, that aren't getting, severe respiratory distress and getting the shortness of breath and having to be hospitalized. Some people are running straight through it without any issues. And as you see, others, same virus, are ending up hospitalized and on ventilators for a month.
Okay, so really the health of the individual before they started really is impacting their success rate.
So most of my patients are alert, have been trying to be their healthiest, and that's why they are here, because they have been taking a functional medicine approach from the beginning, and they use that as their guideline to staying well. So most of my questions have been on patients that take elderberry or take certain things. They do a lot of reading. They're very educated, and they hear about this thing called cytokine storm. And it is a thing to worry about, even with natural products, because you don't want to hyperstimulate the immune system either. And natural products can do this. So they're not, 100%, take anything you want and it's going to be all beneficial. So the most important thing is which nutrients and botanicals have the most backup that could help prevent and possibly treat COVID-19. We don't have a lot of data on this virus in particular, right? So you have to go back, and as we do with functional medicine, is we go back to the biological mechanisms that the body works. So, and then we treat according to those mechanisms. There isn't a lot of data on natural products as there are on pharmaceuticals. And as you know, right now, there is no great treatment right now for COVID-19. There's anecdotal things that we're trying and medications that we're trying. But if you look at the past infections with different viruses, that's how you can gain your knowledge of which nutraceuticals and botanicals will be beneficial and not cause harm. It's always risk versus benefit, right?
Right.
So, in that, my patients are always asking, what do I need to be taking? I mean, right when all of this, came to the forefront, my phone was ringing off the hook. What do I do? What do I take? What can I up? What can I not? What should I stop? Elderberry causes cytokine storm. It's all over the internet and all this stuff. And, elderberry is actually really good antiviral preventative, and it's been used for years for the flu to prevent an increase in the symptoms of the flu when you get the flu. And there is good, strong evidence with elderberry. And this cytokine storm issue was based on one study in the early 2000s that had a bad batch of elderberry. And no other data has ever collaborated that this cytokine storm can occur with elderberry. So I have recommended my patients stay on their elderberry. It's very low likelihood to no issues with elderberry, and I really believe that it's more beneficial than anything else. So when talking about the different nutraceuticals, there is no perfect one. There's no one that I think is the best. But if you go back to what we're trying to accomplish, and that's preventing the virus from spreading and the inflammation from getting out of control, causing this lung epithelium to get all this inflammation and end up with your patient on a respirator. So the things you want to focus on when you're looking at these nutraceuticals is, one, is it going to inhibit the activation of something we call an inflammasome? Because there's one that's specific to this virus. And then there's another one, which is the M protein, which will prevent viral replication. So these are the things that you really look at trying to inhibit in your natural products.
Gotcha.
And right now, my favorite product is quercetin, my favorite one right now, because you can get it from food, which would be red onions, apples, red wine, berries.
You had me at wine. I mean, now
Yeah.
I'm in. I'm totally in now. I mean,
Right.
I don't. I have to switch from Scotch, but that's okay.
Right.
Is it in Scotch? Because if it's Scotch, I'll be even happier.
It's not in Scotch. It's
All
not
right.
in Scotch. It's just from the red wine. But it's my favorite right now because it can prevent the viral replication, and it can decrease this inflammasome that I'm talking about, that if you do come in contact with the virus, you can get this like overabundance of inflammation that causes the severity of the illness. So most of the nutraceuticals and botanicals that I talk about are based on these principles, based on past viruses that they've worked on. So that's basically, how I make my assumption of what's going to be the best for my patient.
Gotcha. So it sounds like there's a kind of a two-step approach as much as anything else is. One is be as healthy as you can. Two, reduce the impact that the virus, because obviously if you get the virus, there's nothing that you can provide that's going to prevent that from happening. Transmission of viruses happen the way they happen.
Right.
But you want to make your patients as healthy as they possibly can. So if they do, God forbid, get it, they still have the ability to kind of weather it. And then additionally have other kind of nutraceuticals that are the kind of reduce the inflammation that can impact the lungs as significant. And that's the supplements you're talking about. I forgot the name of it already. I should have written it down. That's in apples, or more importantly, in red wine,
And
red
quercetin.
onions, apples, and red wine. So
It's
what's the name of that again? Quercetin.
Quercetin.
Okay.
And it was, we use it for allergy prevention and patients with allergies and stuff like that, because it does support the respiratory system as well.
So let's talk about functional medicine in general, because I think that's interesting for people that are less familiar with it, about what the approach of functional medicine is. Obviously, you have a background, you're board certified in internal medicine.
Mm-hmm.
So this isn't like instead of, this is in addition to, but talk about functional medicine and the impact it can have on people's health, to where if they are interested in getting healthier to possibly ward off or deal with illness better, talk to us about that.
Well, functional medicine is my passion, and it always has been, and I've always looked at ways to keep people healthier and like advanced preventative health care. So every day I talk to my patients about, really basic principles. And in functional medicine, you're constantly looking at ways to make sure you dampen inflammation, to make sure the immune system is working the way it should, to make sure that the gut is healthy in order to prevent different chronic diseases, ability to absorb nutrients, ability to make all the happy neurotransmitters, all of these things we look at in functional medicine. What is the psychiatric piece that is leading the body to break down? How can we make your mind at a very happy place so you don't start breaking down your systems. Because as you know, the basics are when you're stressed, your whole immune system breaks down, you cause inflammation, and the immune system cannot function. So those basic principles are always discussed in my office, which is, are you sleeping? How is your gut? What's going on in your life? Are you reaching your happy place? Are you doing the things that make you happy? Are you, less stressed or more stressed? And what are the things that are causing you stress? You got to, mark those off your list and start, taking the things from your happy list and making sure that they happen. So those things are always part of a functional medicine approach. It's like a total body and wellness approach to how you approach medicine. It takes time to sit with the patient and really look at all of their systems, what's going on neurologically, what's going on like in all of these areas. And then you put together a plan to stay healthy and, what's going on with your diet. And we do as much as you can through your diet. I mean, you've heard it 1,000 times. Hippocrates always says, let medicine be thy food and food be thy medicine. And that's pretty much the basic principles. And if we did that, most of these people would be on less medications, right?
Mm.
So now, like patients that were on medications for blood pressure, they're saying that patients that are on ACE inhibitors, the virus is attached, it's the entry into the cell, this ACE receptor. Are these patients more at risk? Are they not? Are they getting more severe illness? It looks like they are. Patients that are on ibuprofen and nonsteroidals are getting worse of an illness. And I've always preached to my patients or tried to collaborate with them on how can we get you off all of these medications? Is it gluten that's causing your pain? What is causing your pain to need a nonsteroidal anti-inflammatory? Because there are side effects to all these medications. And that's what's been my passion, is to keep people on the least amount of medications that they can so their bodies are as healthy as they can be. So that's pretty much what functional medicine is, just going back to the basic biochemistry of the body and making sure all of it is working as good as it can so the patient isn't in a state of dis-ease.
Gotcha.
So that's basically.
So reduce the amount of traditional sort of medication, pharmaceutical
Mhm.
style medication, as much as is reasonable. Obviously,
Right.
you're a doctor, you can still prescribe that stuff as necessary.
Right.
But adding on other pieces of it. So what are some of those other things that you would have in addition? You mentioned, you start with their diet, but what
Right.
other things? You mentioned kind of nutraceuticals and supplements prior. Give us examples of what that looks like for a typical patient.
I'm not really understanding your question of
So
what you do on a daily
So,
basis.
so, so obviously, you start from a functional medicine perspective. You're starting with food as a primary way of starting, based on a person's
Right.
specific need,
Right.
and from there, you have other things that you have people take, such as nutraceuticals. What are some of those types of nutraceuticals that you have them do, and what are some of the other modalities that you implement to help that person kind of be at ease and living that kind of healthy lifestyle?
All right. So the best way to deal with this is what's the pop topic right now is the COVID-19, right? So if I had a patient that came in and their primary concern was COVID-19, preventing COVID-19 and all of these things, you actually sit with the patient and you start from birth to see when was their stress, where is their stress coming from? Because as you know, the body holds trauma, which will lead to stress and be triggered. So, you start with those kind of questions and do they have autoimmune disease? What kind of conditions do they have? And then when you get through all of that and you've dealt with those kind of like, preventing the disease in the body with the patient, we can talk about nutraceuticals based on their conditions. So if I had a patient that, let's say, you can't put someone on 12 nutraceuticals. There's about 12 nutraceuticals right now that could actually help with, there's good evidence, some greater than others, that it can help prevent and or treat based on the principles I spoke about
Right.
earlier, COVID-19 or other viruses in the past that maybe have been similar to COVID-19. So when I do it, the patient's not going to want to take 12 nutraceuticals for this one problem. But say I have a patient that has a hormonal imbalance, a male patient, and they have other, types of issues in their physical exam, and you can see that a lot of people are zinc deficient. Do they have signs of zinc deficiency? Because if you've noticed COVID-19, there's this whole thing about smell. Patients are losing their sense of smell. My prediction is these patients are the very patients that already had zinc deficiency. Zinc is a really good thing in this male patient because it'll help with processing of the hormone balance. It can prevent patients from having a better thyroid function. So if my patient had a thyroid issue, maybe I would pick zinc to be one of the nutraceuticals I would use, because zinc, again, has been shown to help in respiratory illnesses, to promote the immune system. And what we're looking for here is types of modalities that modulate the immune system. And what that means is when the immune system is needed, they can activate the immune system. And when the immune system needs to be dampened, they can dampen the immune system, not letting the immune system go out of control.
Isn't that one of the fears with regard to what the kind of not the side effects, but one of the true fears of the COVID-19 virus is that the immune system starts to almost attack itself as a result.
It almost becomes autoimmune. Yes, exactly. So you look at things that modulate the immune system. So everything that worked for your autoimmune conditions would actually help modulate the immune system. So you have nutraceuticals.
Which is why, I'm sorry to interrupt, but which is, I guess, why, one of the primary drugs that you're using to treat it is traditionally a lupus drug, which is an autoimmune disease.
Exactly. And that's showing some effectiveness. There is also one antiviral that they're doing a study on in China. They actually treated patients with IV vitamin C in China, and they're also doing a quercetin study in China. Those are a lot of the studies that I've heard about and read about. In terms of nutraceuticals, curcumin's another great one. As you know, vitamin C is great. 1 to 3 grams a day will help both. Everybody knows vitamin C works with the innate and adaptive immune systems and can modulate the immune system. Another excellent one is green tea. Just 4 cups of green tea, Japanese green tea a day. Again, that'll modulate the immune system, help with this inflammasome, and with viral, you want to prevent the viral replication. I already spoke of elderberry. There's other ones are, what else? We talked about zinc. There is a lot of other good nutraceuticals out there. A lot of people are talking about oregano oil and all of its antiviral and antifungal properties as well. So my favorite right now is quercetin, the C, the zinc, and things like that. There are, and the green tea is excellent. Like I spoke about, there's something called PEA also that has been used to treat the flu and prevention of the flu in the past. There's really strong evidence with prevention. So there are a good amount of nutraceuticals out there with very minimal harm.
Right.
There's been rare incidences of the component of green tea causing some hepato issues or liver issues, but it's so rare. Most of the nutraceuticals are very limited, really to mild, no harm.
Right. So that's great information. So question for you then, how many nutraceuticals do you personally take on a daily basis, and does the rest of your family take on a regular basis?
It depends on what each person has.
Okay.
3 teenagers, they all have different issues and different things. My husband and I are different, but I think I take about 10 to 15 supplements a day.
Okay. So
so
the 12 number that you would sometimes prescribe to people is actually not that far-fetched if as soon as you start really feeling the better. So the rest of
Right.
your family, how many do they take?
You know what? Everybody has about the same.
It's
Everything is ratcheted up a little bit. Of course, I'm optimizing D in everybody. If you know, D is huge. It helps with macrophages. It helps with again, fighting, activation of this inflammasome. It'll prevent viral replication. It's huge in the immune system in so many different ways. And I can't even tell you how much published data is out there. The biggest thing is there's a little bit of controversy on what is the optimal range. And in functional medicine, we shoot between 50 and 80, and that's the range that we use. I have endocrinologists and I have regular internists that they look at 30, which is it's deficient. It is deficient, and you're not really getting the benefits that you should from vitamin D. And there's so much published data on how vitamin D works in the immune system,
right.
and how great it can promote as an immune modulator. And then again, that's the term I'm using. You want to modulate the immune system, and vitamin D is fantastic for that. And it works well on autoimmune issues. So right now I'm recommending 5,000 a day of D, while the virus is going on. Even vitamin A, it can be toxic at high dosages, but 10,000 a day is not a big deal. And that protects the respiratory epithelium and the lower respiratory epithelium. You want to do that. So you don't want to be vitamin A deficient right now. And in functional medicine, we always look at these nutrients and we see if people are deficient, and we're looking at all these natural ways to stay healthy. So most of my patients are optimal on their nutrients to begin with. So I have had several patients that have had COVID-19, and they've all just went through it without any issue.
Wow.
Yeah, no issues.
That's amazing.
Yeah, another good one is melatonin, making sure you're sleeping. You're not sleeping, you're not repairing. Again, the immune system is extremely off if you don't sleep. And melatonin is an amazing antioxidant. So resveratrol, huge right now, 150 milligrams, even once a day, great. Works the same way in modulating the immune system.
So what are the differences then between like the high-end nutraceuticals that I know that you sell out of your practice and what's available at, say, at Costco or at Publix kind of thing?
Well, this is a sad state because, there was even a study done once on, so many times there are studies done. And what they say, a lot of times with these over-the-counter supplements is what's in them isn't actually in them. So if you aren't using a facility that tests, looking for heavy metals, looking for proper dosages, looking for synergistic activity of the different nutrients, and they're testing and they follow the GMP standards, you're really at a disservice because you could be just ingesting something that's garbage. I have even had a patient once they were taking a supplement to promote growth for their son. That from, I don't know where it was from, Whole Foods. I think it was from Whole Foods.
Right.
That he ended up with an 800, no. So it was above normal range, probably 1,200. And this was like a 10-year-old kid of testosterone, which would have potentially shut down his growth plates and this, that, and the other, instead of caused growth. And this was some supplement they were taking over the counter. Because there was even once a supplement, there were 6 supplements that were studied. They were all calcium. One of those even had dilantin in it. It was a calcium supplement that had dilantin. So when you're getting all of these things over the internet or in a regular vitamin shop, a lot of it is adulterated. These herbs are adulterated. You have to be very careful that you're getting your things from a reputable source.
Right.
And you have a great pharmaceutical grade companies out there. They don't promote their supplements on the internet. And sometimes people are repackaging their supplements with their bottles when you buy it on the internet. So it's a weird world sometimes.
There's no regulation to the supplement industry. I mean, I know that's always been a concern of a lot of people who, who valued health and value science, because, I'm not going to pick out any specific, companies out there, but there's a lot of supplement companies out there. They're popular. They're in malls. We all know who they are. And what they sell isn't necessarily the best for you because there's no regulation of the industry. So when you buy it from a reputable source, when you buy it from your doctor, obviously, who is able to kind of vet who they are able to purchase it from, you kind of get a much higher quality product. So that makes total sense to me. I think it's kind of fascinating how the FDA has not stepped in to sort of regulate this industry, because it's become so large that you don't really know what you're getting. And yet, like you said, like the kind of the horror of that, your patient who had a child who was giving him a supplement to improve growth, and it could have actually harmed him permanently. I mean, like, super high doses of testosterone.
Right.
It's horribly scary because you're trying to do the right thing for your child. You're spending a ton of money in doing it, and the results could be horrific. I mean,
right.
Exact opposite of what you're trying to actually do. So it's kind of, it's scary stuff that's out there. I mean, so if for people that are not able to purchase it directly from, their physician, how would a person go about making those sorts of decisions? How can you find out what's reputable, what's not?
Now that's a good question. You have well, I mean, all the functional doctors and, that are functional medicine practitioners do have these pharmaceutical grade supplements. It's just good to be savvy in what you're getting and talk to them about what they're carrying. So, I have visited the facilities where I have branded my supplements, the majority of them, and I find out which ones are the best. And I know what the type of quality that they are. And there's a lot of different physicians like me who carry great products. My patients will all bring all their supplements in for me to look at. Sometimes, they have 3 bags of different supplements that they've been taking. Some are garbage and some are great. The best way to do it is do it through a functional medicine practitioner and do these that have these pharmaceutical grade supplements would be my advice.
I have this great visual of somebody almost like the classic, a person walking into their CPA's office and just dumping their shoebox full of receipts going, you figure it out. That's sort of what they're doing to you with regard to their supplements. So talk to me about education. You mentioned kind of functional medicine physicians, and I'll kind of wrap up on this topic. Talk about functional medicine physicians, and obviously you went to medical school.
Correct.
There's a lot of functional medicine physicians who didn't go to medical school.
Mm-hmm.
What are your feelings on that subject?
Well,
not to put you on the spot.
It depends on what kind of patients you're getting. A lot of those functional medicine physicians will send their patients to me because I have an integrative background. So I did get boarded in integrative and holistic medicine, and I did a lot of training in functional medicine. And I've had a solely functional integrative medical practice now for over 10 years. So I think it's difficult to deal with the sick patients that have severe autoimmunity and things like that, battling Lyme disease and mold issues. It's just a different level of education. So I don't feel like they can give a surface. It depends if you're like a well patient and you don't have a lot of issues, maybe you can try something like that. But it's hard without that background to really understand the pathophysiology behind each disease system that these kind of things work for. Yeah. Right. But the IFM and the MMI and all of these different educational, places do a good job of trying to teach these patients or these practitioners. But I think it's really hard to learn if you don't have that background, if you don't have an internal medicine background. And I feel like there are a good amount of us that do have that internal medicine background, and I think having someone that, is a DO or something like that's even better because they're actually taught that way They're taught a holistic approach to medicine, and they are patient specific and not disease specific, and that's in their training. I mean,
Right.
that's what they did for the past 4 years when they were in med school. So it was ingrained in their training to begin with.
Gotcha.
You know, I mean, everybody is different. You know, you got good doctors, bad doctors. You never know. You just gotta, I think if you don't have the degrees and you don't have the education, I think it's hard to integrate all of it.
Right.
Um,
By definition, if you don't have the training, then you don't have the
if
training.
you don't have the training,
You don't have the training. I mean, that's the reality of it.
right.
So,
And, I'm a board examiner, and, we're trying to get good practitioners and in the field. But the problem is, sometimes it's just such a lack of the basics that they can't pass the exam. And the ones that have internal medicine background or have the, a medical degree, they zip through the exam. The ones without, they can't.
they
It's
struggle.
difficult for them. It's
Sure.
difficult for them to pass.
It'd be hard to pass the bar exam if you didn't go to law school. It's an
Right, right.
advanced, I assume. So
Yeah, yeah.
awesome. Well, this has been wonderful. Thank you so much for your time. Why don't you give us 20 seconds, a quick plug for your business before we sign off?
For my business, I mean, I'm here to help in any way I can to support your health. And if you need me, I'm here. Everyone that comes into my office is really just a gift for me to help. And I don't do a lot of marketing for that reason, because I feel that who needs me will find their way here. And I'm here for you. That's it, you know.
That's good. Well, not physically right now. Physically, you're doing a telemedicine.
Physically, it's all telemedicine. It's all telemedicine. There are some things that I would love to open up right now for my patients. Like, there's ozone therapy for this, and there's, IV vitamin C drips and all of that. But right now, the office is closed for all those therapies until
Right.
till
Until it's
it's
safe to do so.
so there's not so much social isolation, and the nurses can be safe. And so we're doing as much as we can through telemedicine, and it's only emergencies really that,
Gotcha.
yeah. But I'm here for you, whatever. If you need me, I'm here. I hope to help.
Sounds good. Dr. Noble, thank you so much for your time. Have a wonderful, wonderful day. To everybody else that's out there, I hope you enjoyed this. If you have any questions, I will include Dr. Noble's information, how to contact her, right in the description below. Until next time, I am Jeff with Flying Chimp. Be safe, be well, be the community, and remember to pass the hat and help your local businesses. Take care.
All right. Thanks, Jeff.